It's time for MASH Camp. I'm Lisa Oligus, and this is Newsmakers. In this edition, we explore the offerings of this year's MASH Camp and learn more about the organization that launched it, the AHEC. MASH Camp stands for Missouri AHEC Science and Health Camp, which exposes high school youth to healthcare career opportunities. Joining us with details of the upcoming educational event is Dr. Tricia Riggs, the Executive Director for the Southwest Missouri Area Health Education Center. Thank you for being here.
Well, thank you so much for having me.
So let's start with a little bit of background on the roots of the camp, which started in 1994 by AHEC, which is the Area Health Education Center.
Yes.
The goal was to build a healthcare workforce, right?
Yes, so that is AHEC's ultimate goal, is to increase the number of students who want to go into healthcare careers. And so this is just one way to keep students engaged over the summer when they're not actively involved in anatomy and biology classes throughout the year. And so we want to keep their interest level high.
Yeah. So AHEC received some grant funding for its mission. Tell us about those grants and how they work.
Yeah, so we actually have several grants. Majority of our funding is federally funded from HRSA, and then we also have state funding. And a lot of our objectives associated with those funding has to do with high school recruitment or high school pipeline programming, as we like to call it. And that is where we will go into high schools and specifically in rural areas, because we like to give students what we call transportable workshops. So we'll go into the schools and the students will get workshops on things like phlebotomy, infectious disease, healthcare career options. You know, we like to let students know what options there are out there in healthcare, aside from just being a doctor or a nurse, because a lot of times that's all that they have heard of, and they, you know,
if they haven't been sick and haven't had to go to a hospital or see all the different multiple jobs that happen in a healthcare facility, they may not know that those jobs exist.
Exactly, and so things like MASH Camp also introduces them to different departments in the hospital. So we usually have workshops in like radiology, you know, have speakers there, people from the lab usually come, you know, so we'll get to see all those different aspects.
It seems like it might be very young for a student to say, oh, I'm in high school, I know exactly what I want to do. So does this kind of also then maybe kind of just act as encouragement for students who I haven't really decided?
Oh yeah, absolutely. You know, they may be receiving that push to go into healthcare from family members, or maybe, you know, their aunt was a nurse or something like that, you know, and so they feel like they want to do it, but they just don't know what's out there. And so this is a good way to let them see the different opportunities. It's also, this may sound bad, but it's actually also good for them to see it, and then if they don't like it, they know not to go that route.
Right. Well, I mean, so we often hear nursing is a tough career, especially like during the pandemic. We heard about that a lot. Is there a lot of turnover in healthcare positions so that we do need to kind of constantly be recruiting and encouraging?
There can be, absolutely, but the need is always there, especially in nursing. There's always a need for nurses, but we see it across the board that there's opportunities and availabilities, openings in just about every department.
Mm-hmm. So we hosted the MASH Camp here at Missouri Southern last year, which was exciting, along with another medical facility, and we can show some images of those. Why do you think a camp like this helps students determine their path in healthcare? I mean, why is it important, like, you know, that immersive and that hands-on? Can it be a deciding factor?
I think it can be, you know, especially with the hands-on stuff. It's better than just reading a book and looking at pictures, you know, getting their hands dirty. Kids like to do those things, you know, and so if they can actually see and feel what they would be doing, you know, it helps them to know if that's something they would really enjoy doing for, you know, their whole lives.
So tell us about this year's MASH Camp. Who's hosting? Where's it being held?
So we actually have 4 MASH camps this summer. The first one is in Joplin, June 18th and 19th. So we will have one day at Mercy in Joplin, and then another day at the Kansas City University, the KCU campus.
So, and tell us a little bit, I mean, who's best suited to go to a camp like this? Because a kid might think they want to do it. Do they have to have taken any classes in high school yet, or even in grade school to know they're on that path?
Not necessarily. We are focusing more towards high school students, or potentially even first-year freshman undergraduate students. Of course, it's helpful if they've had biology or anatomy type classes, but it's not a requirement by any means.
Yeah. So how can a student register?
So you can go to our website. We do have a link for that on our website. Will you show that?
Yeah, we can show that.
That would be great. We would like to have people register by June 11th for the Joplin camp. We also have one the very next week in Monette. If that is closer to where students live, we actually need more participants in the Monette camp. Otherwise, we may have to reschedule it. So we're trying not to do that. So
well, because this will be airing when the registration deadline happens.
Yes.
So maybe if they don't make it into the Joplin camp, they can make it into the Monette camp.
Absolutely. And Monette is also 2 days. They are $40 to participate, but we do have scholarships available if that is problematic for anybody.
Right. We're going to take a break, and when we come back, we will get a rundown of the activities planned for this year's MASH camp and learn how AHEC works inside classrooms as well to get students geared up for medical careers. We'll be back. MASH Camp is coming to Mercy Hospital and the KCU Medical Center. We are joined again by Dr. Tricia Riggs to learn more about it. Dr. Riggs, let's talk about some of the tours and activities students will experience during MASH Camp. So let's start with Mercy. What would they see at the hospital?
So at Mercy in Joplin, they will get a full tour of the whole facility, which is a wonderful tour. And we get to see, we go down in the basement, we go down in the tunnel, we see the cooling rooms and all of the things that kind of go on behind the scenes in the hospital as well, which is also kind of interesting for students to see because maybe they don't end up wanting to be in patient care, but they can see some of the other inner workings of the hospital, such as the computers and the security and the things that maybe you don't see as a patient, but are still necessary for a hospital to operate. So they'll get
and then they'll go see obviously those things you expect to see in hospital. Will they go through the ER?
Yep, they'll go. Usually we do go through the ER, maybe see the obstetrics unit, the hospital bed unit or med-surg area, the labs, radiology, we usually can see that as well.
Yeah. So I know in some of these camps they've included dissection. So what kind of immersive experiences do you think the students will be finding? And I did hear mentioned that there might be a suture lab with the KCU students.
Yeah, so I think we might do the suture lab at KCU. We work really closely with KCU and their medical students, and so anytime we can have the medical students help with any of the camps or with any of the workshops, it's always it's just more fun. The medical students are closer in age to our students, to the high school students usually. They're cooler, they've been through it. I haven't been to medical school, I don't know exactly what it's like, but they have, and so they can also talk to the students and kind of mentor them, and they can ask those questions as well, which is really neat. But suturing is always
a lot of conversation that happens as well in these events? I mean, can they actually pick the brains of physicians and future physicians to say, what was this like?
Yes.
Do they learn about the long school process?
And medical students usually like talking about it. The nurses or physicians who help out with the camp usually always like to tell about their journey, and maybe some knew all along that that's what they wanted to do, but maybe some, this is a second career for them. And so they can talk about that, and the students always get a lot out of that.
Yeah. KCU is an osteopathic hospital, so will there be any kind of demonstration and manipulation, and do they get to visit, as well with those during that happening?
Oh yeah, absolutely. And a lot of people in the general population don't really understand the difference between a DO and an MD. They might see MD and they know exactly what that is. That's a doctor. They see DO and they may not know exactly what that means. So it's the same curriculum, that a medical student in the MD program would get, but they also have the component of the osteopathic. And so that is more of the whole body approach to healing, to wellness. They're able to do some what they call manipulation, which is kind of similar to chiropractic techniques. There's a lot of similarities there, but they're able to do some muscle relaxing, negative muscle energy and things like that to help alleviate just typical body aches that you may have, or realignments, things like that.
That could be a real eye-opener for a student who didn't realize that there are even two different medical paths you can go down if you're looking to be any kind of physician.
Yeah, and it is getting better as far as the awareness of what a DO is, especially in the Southwest area, because we have the medical school.
That's right.
And we've had DO medical students in the area for a long time as well. So that's a good thing for our area.
What's the outcome? What are the reactions? How does this impact those students? Do you get a lot of good feedback after you do a MASH camp?
Oh yeah. We get that feedback. We have evaluations from the students that they always fill out at the end of each day, actually. And then a lot of times we actually have returning students who come to MASH camp several years in a row. Even though we do a lot of the same types of activities, it's not always the same every year. And we have different speakers or different departments come, and so they always get something new out of it each time they come.
Do they get paired with a mentor? Do they get to do job shadowing during this event as well?
Not necessarily at that event, but if that's something that they're interested in, we can certainly help get that arranged.
Yeah. So medical school can be a long trek. Is there sort of a reality check of sorts to explain the in-depth of learning required for this field? And does it, can it be a wake-up call?
I think so. There's a lot of glory that comes with the idea of being a doctor, but they may not understand, it's 4 years of undergraduate college, then it's 4 years of medical school, and then you have to do at least 3 years of residency after that, before you start making, the big money that they think that they'll get right away. And, you have to do well, and there's a lot of competition. So it can be, for sure.
Can this be helpful and important for the students to help them determine if they have an area of specialty that they want to go into? And is it important that you know that early in your study of medicine, or not?
I think it's good for them to see the different areas out there, that you can be an endocrinologist, for example. You could be, a surgeon, you could be an obstetrician. They may not know all of the different specialties that you can go in. And it's good to have that as, in the back of their minds, as this is kind of the route I want to go. But you don't necessarily need to have that figured out. Even up until your third year of medical school, a lot of students don't know for sure what they want to be when they grow up. I work with third and fourth year medical students a lot, and a lot of times it's, nearing the end of third year when I say, okay, it's time to figure it out, because that's when they start auditioning for residencies. So,
I see, okay. So what if during this camp somebody's, you might get a little creeped out by something if they see needles or see this, do a little dissection. And you mentioned that there might be other careers. What are some of the other careers that might be poised to them, like saying, hey, you might like a healthcare environment, but maybe you're better off as being a nurse assistant or something like that?
Yeah, and we certainly talk about the different options as far as that goes. However, in patient care, they might always see something that they don't necessarily want to. If they are not a needle person, we might say something more like dietitian, or something that's not as, hands-on.
Yes, yeah,
I guess.
You bet. So how can this experience possibly open doors for students? I mean, do they get connected with maybe even some of the experts in this field that might say, hey, you've inspired me, or, connect them? I mean, does going through MASH camp, is it good on the resume? I think it is. It does help students to get those connections, to meet people. I've had students who have come back to the area and say, hey, can I do a rotation with Dr. So-and-so? I met him when I was back in high school or whatever. Yeah. And so it is good to have those connections and to get those while they're young. It certainly does help. Yeah. So tell us some success stories. I mean, do you feel like you have students who say, hey, this really worked out for me? I mean, have we had doctors come who are past participants in MASH camps?
We actually have. So the thing about our AHEC pipeline programming is that it's a pipeline, which is very long. We used to start programming as early as middle school even. We've
Wow.
switched focus a little bit to more towards high school and undergraduate, but laying that foundation when they're early is always a good thing. But yeah, we have had several students who were AHEC participants in high school. They went on to medical school. They've gone on to do their rotations in the Springfield area and worked with the AHEC, in Springfield. And then they go to residency, and then they come back to our area, which is always what we want anywhere in the Southwest Missouri region. And then they take students for us for rotations. So that's always like the ultimate goal for us whenever we start these pipeline programming is that they will not just take students for us, but whatever they decide to do, they'll stay in this region and practice here because this is the area we're trying to increase.
So you mentioned that they come back and work with you. You do have some graduates of the program who do then actually go into high schools and help share some of the messages. Talk to us about what happens there and why is that so empowering?
So we have been using, just this year actually is when we've kind of initiated this, but we have a graduate assistant who's in the Master of Public Health program actually. He's from Tanzania, and he was a physician in Tanzania, and so he came back here. He already has a lot of that experience, but he's furthering his education here in the United States, and so he has been able to go and do some workshops in the high schools, and the students have just absolutely loved it because yes, he's still a student, and so he's in the process. Yes, he has all of these cool experiences that he can talk about, and the students just eat it up.
Does it help to go into those you mentioned it earlier, going into rural schools? Do you feel like sometimes they might miss out on bigger programs? And is it helpful to kind of plant that seed?
I think that it's actually been more beneficial for us to go to them. We used to have a program called ACEs where we had students in high school apply to be a part of the program, and then they would all come to Springfield or come to Joplin or come to Bolivar, some centralized area where we would do some sort of workshop with them then. And it was extracurricular, so it was after school, on the weekends, that type of thing. We discovered as time went on that students were getting busier. They had sports, they had jobs, they didn't want to come do extra things after school. And so we had a lot of issues with attendance with those types of programming. And so we switched focus to then going to the schools. So we do have our schools that we go to on a regular basis so they can maintain that contact with us and get our regular programming, which has been a really good. It's actually increased the number of students that we have contact with, not by just a lot, but by a lot.
Yeah, like how many schools are involved and how many students?
Oh, well, just as an example, in ACEs, we typically would have roughly 30 students participate. And this last year, we had over 3,500 students that reached some sort of contact with us at one point or another.
Wow.
So it's maybe not quite as in-depth, but we're getting out there and we're making that contact with them, giving them some sort of education, and I think it's been a lot better.
Does it help you to have schools that offer medically based kind of classes as part of their maybe technology center programs, and those kids get a head start on their education?
I think it's a great thing, and we have also collaborated with programs like the Go Caps at different schools where we've gone in and taught like a certain program that is in conjunction with what they're already talking about, or something that they don't offer. We can come in and offer it, which has been a good partnership. But yeah, a lot of times in the high schools, we might focus more on the biology classes, anatomy classes, health classes, something like that, where the students are getting that background foundational work already, and then we can just kind of enhance what they're already getting.
All right, so let's remind folks of the MASH camp in Joplin, and then you also have other MASH camps, right?
Yes, we do. So we have the Joplin is June 18th and 19th. Monette is the next one, and that is the following week. Then we have a couple in July as well in Bolivar and in Springfield. But all of the information on all of this, is on our website.
All right, thank you, Dr. Tricia.
Thank you so much.
Well, We're going to take a short break, and when we return, we'll visit with Dr. Andrea Cullors, who helped host MASH Camp last year here at MSSU. We find out what students were able to see on campus and the opportunities for them to learn in real-world healthcare settings here at Southern. You're watching Newsmakers, where we are talking about MASH Camp. It was held last year right here on the MSSU campus. Joining us to discuss what students experienced and what is available to students studying healthcare here is Dr. Andrea Cullors with the Department of Kinesiology. Thanks for joining us.
Thanks for having me.
So you were a part of last year's camp, and I remember you putting students through some very rigorous jumping drills. So what was the lesson there, and why do that?
Yeah. So with the kinesiology department, we have an exercise science degree, and oftentimes people don't realize how integral that degree is with healthcare. They don't see that it's part of healthcare. So with exercise science, we can either look at either the preventative side of disease prevention, injury prevention, or how do we rehab people. So the activities that we did with our group were really looking at fitness testing, exercise testing, mobility, strength. So all of those components that are important in both prevention and the rehabilitation of illness and disease.
How can that help a student who might be thinking of, well, should I be a doctor or should I be a physical therapist? Mm-hmm. Does it give them an idea of what they might be running into in the real world?
Yes, so sometimes they don't really know what a physical therapist does or an occupational therapist does or that side of prevention and or rehabilitation. So seeing how do you do a jump test and what's the purpose of seeing how high or what someone can do jumping. We did a lot of balance activities, which are so important with older adults. And so how does that play into preventing or treating disease? We did body composition. So all these different things that you would do as a allied health profession and OT, physical therapy, even personal training, which can really be part of that disease prevention.
And it all might give them an idea of general practitioners of the overall picture of health as well.
Yes.
So here at Missouri Southern, we have, the students learned about respiratory therapy, got to tour radiology, even our cadaver lab. How unique is it for us to have a cadaver lab? And I think that's even going to be expanding in our new healthcare center.
Yes, so we are very unique. It's very unusual for undergraduate students to have experience in a cadaver lab. And for students at a university this size, it's even more unusual. Through my undergraduate, graduate, doctoral work, I never had an opportunity to be in a cadaver lab. So our students have just a phenomenal opportunity. And then with the new Health Science Innovation Center opening in the next few years, I think most of the third floor will be dedicated to cadaver lab and other lab space for that type of work.
So when these high school students come from MASH Camp, seeing that, what's the benefit of being able to go see a cadaver lab? I know that one of them even got a little queasy.
Yeah, so is this something that you are interested in? So we have students all the time that think they want to do something and then they get experience in the field and it may confirm it or they may be like, no, this isn't for me. And so being able to be in that room with a cadaver, are you comfortable with it? Does that pique your curiosity? Or does it make you feel squeamish? Are you nervous about touching it? That may make, if you can't do it there, then maybe medical school or being a doctor isn't the path for you. And then the camp exposes students to careers in healthcare they may not have known existed, like respiratory therapy. They may not have known that was a really viable, great career to have. But through that camp, they know that it's more than just doctor and nurses. There's
Exactly.
so many other opportunities in healthcare and allied health.
Kind of broadens their horizons.
Definitely.
So we even have a fully operational dental hygiene clinic on campus that must be impressive to some students to see. And I think the students even had a hands-on lesson on injections last year.
Yes. So from what I've learned is they will use hot dogs and they'll use needles to kind of mimic what gums do. This past semester I taught nutrition for dental hygiene students, and that was just really great because that is such an important career field, and there's such a lack of dentistry in our area. It's really important that we have dental hygienists in our area.
I guess also getting that immersive lesson could also show you, I'm not really good with needles.
Yes, yes, definitely.
So what's the takeaway from activities like that for students? And what do you think is the biggest benefit of MASH Camp, having those hands-on opportunities?
Well, I think as high school students, they're really getting exposure early to things that they may not have known about beforehand and things that they may be interested in that they didn't know they were. So they're getting that early exposure that hopefully they can continue. So it may give them an idea earlier about what they want to major in college, what area they want to go into. It might lead to them having more exploration, more shadowing, so that when their time in college can be well spent and focused, and hopefully preventing that changing majors, because instead of those experiences when they're in college, they're getting them early and they're not jumping around to find things while they're in college.
And there are even some high schools that offer medical-based classes that can prep you for college. Would that even give them insight to, oh, maybe I should get this little certificate now?
Yeah, definitely. I think the more either job shadowing or experience-based classes, the more experiences that they can have, it's really going to allow them to go into college more prepared, know the classes they need to take, get into the right department, and start making those decisions earlier on to be the best prepared and most successful student possible.
Why was it important for you to have kinesiology be part of MASH Camp?
I think because students, the public often doesn't realize the importance of our field in health. And so I think that was really important, getting students to realize that so many allied healthcare professions can go through the exercise science degree. And then also it's, I just love our faculty due to sharing our passion for health and fitness with others and with young people. Because even if they don't go into exercise science, being active, if you're a healthcare professional, preaching that is so important, and encouraging your patients to be active is just really important.
Well, and we even heard about it at the Healthcare Summit. Preventative medicine is very important. So kinesiology does play a role with that. And I mean, even if they were a general practitioner, getting the lessons they heard from you, they could incorporate that into their field of study.
Definitely, definitely. It's important as for every physician, for every nurse to know the importance of physical activity and healthcare prevention, and often that rehabilitation side as well.
Excellent. Well, Dr. Andrea College, thank you so much for sharing all this information.
Thank you so much. Yep, thanks for having me.
The MASH Camp is taking place June 18th at KCU and 19th at Mercy Hospital, Joplin. Registration is available on the Missouri AHEC website. That wraps up this edition of Newsmakers. Thanks to our guest, and thank you for watching.